The next topic, what is your approach to state health care financing? Mr. Smith?
My top priority is health care. There are two problems: the availability of insurance and its cost. There are 1.3 million people in Ohio without health insurance. 600,000 of them are working adults. In the greater Cincinnati area, there are 270,000 people without health insurance. That's enough to fill Paul Brown Stadium 4 times over. I have a friend who can't get health insurance because she had some back surgery. But that was 30 years ago. People have told me that they've been fired from their jobs because their health costs are so high it increases the premiums for everyone else. I talked to a farmer in Warren County who said that her premiums were $25,000, and that was just for her. This is ridiculous. The reason insurance companies won't cover my friend and increase their rates willy-nilly is because these folks are too much of a risk to them. They want people in groups. Well, I say let's give them what they want: the mother of all groups. I want the state to administer and then manage a group, an insurance group, that anyone could join and all pre-existing conditions would be covered. Now, this is not Hillary Clinton-style socialized medicine. People would still pay premiums, and those premiums would pay both the state's costs and it would pay for their health care. Insurance companies would still serve that group, but basically they would be kept on a very short leash. Small businesses could join this group to lower costs. Entrepreneurs would always have access to insurance. And then what we can do with this group is start to lower the costs of health care. Do things like make sure that everyone has the preventative medicines that they need. Introduce lower cost and proven alternative medicines and medications and therapies instead of some of the most expensive surgeries and medicines. And then finally, we have to get serious about tobacco and obesity, because these things are going to overwhelm our system. Thank you.
Mr. Schuler?
Okay, thank you. Obviously, it's very important that all our citizens get adequate health care. I worked with the Lincoln Heights Health Care Center for a few years in order to get funding there. And it's a state-of-the-art health care clinic which serves about 12 communities in north part of Hamilton County. We need more of these so that people who are uninsured or underinsured, and some people with insurance, prefer to use this clinic, and they get good care. And they get a complete spectrum of care: dental care, different specialties through health care. We also need to expand the CHIP program, which is Medicare or Medicaid for children. We need to promote that more. 2/3 of the cost that's paid for by the federal government, so it certainly benefits the state as well as those families that receive that care. If we promote that and get more families to get that service. In addition, we've started a Medicaid buy-in, so the people on disability who most want to work if they can, and oftentimes can't because then they lose their insurance, and they have to have that insurance because of their condition. On a Medicaid buy-in, which is a waiver through the federal government, they'll be able to get their insurance and actually get Medicaid and be able to work and be productive citizens, tax-paying citizens. As far as medical insurance, almost everybody now needs medical insurance just because of the way things are built. If you go to a hospital and you don't have insurance, they'll charge you a very high rate. If you've got insurance, they negotiate those rates way down. So regardless of the type of insurance, you need it. And the state has Senate Bill 5, which is pending, which would provide employers to alternative plans so that they could have larger affiliations and get more people on insurance. And also there's Senate Bill 272, which would provide a pooling of high-risk insurance people so that they could be insured also.
Thank you. Mr. Smith, would you like 30 seconds?
Yes. Let me tell you what the state legislature's done with Medicaid. Basically what they did was they threw people off the Medicaid rolls and upped the premiums. And they did that last year in order to pay for a 21% rollback in income taxes, which pretty much, most of that goes to the top 5% of families, those earning $120,000 or more. If we really want to fix the Medicaid system, what we need to do is allow people, don't cut them off at the knees whenever they get, when they get over the limit. We need to provide a graduated system so they can wean themselves off.
Mr. Schuler, would you like 30 seconds?
Yes, the most important thing we can do for Medicaid providers is put them in a position so they're instead of making $18,000 and be qualified for Medicaid, they're making $25,000 or $30,000 or $35,000 by having jobs. And when we do a 21% decrease in income tax, or when we did the other decreases in taxes, that provides more jobs, that brings industry here. So we won't need to spend nearly as much on Medicaid.